La ilaha illallah Muhammadur Rasulullah. La ilaha illallah Muhammadur Rasulullah. La ilaha illallah Muhammadur Rasulullah.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Because of lack of time, I'll try as much as possible to talk about this topic in brief. Well, we already have the program, and what we are supposed to discuss this morning is peptic ulcer disease. And I'm sure all of us at some point in our lives have heard about peptic ulcer before, or what is generally called ulcer. Now we have an outline that we want to go through briefly. We'll talk about what is, what is the definition of peptic ulcer, what causes it, what are the symptoms, or in other words, what do we feel, what do you feel if you have ulcer, and how do we know when you have ulcer, in other words, diagnosis, and then what are the treatment options we have for people who have ulcers. And then we look at prevention of ulcer and conclude, inshallah. Now, for definition, peptic ulcer is a set of wounds in the lining of our intestinal tract, and particularly the parts of our intestines that can develop wounds. First, the first part of the intestine that we call the esophagus or the gullet. For some of us who have done biology before, I don't know if you remember this. Then down the line, below the esophagus, we have what we call the stomach. That is where food collects when we swallow food. Then down the line, we have a very small curved space that is called the small intestine. That part that is connected to the stomach is called the duodenum, and that's where we also have ulcers. So the commonest forms of ulcers are those ones that occur either in the lower part of the esophagus, in the stomach, duodenum, and rarely other parts of the intestine. Now, the name peptic ulcer came from the major cause of that problem, which is digestive juices called pepsin. And so that's where the name came from. And so it is, what are the things that cause ulcer? I know that for most of us here, when we say ulcer, it's hunger that comes to the mind. It is not exactly like that. Because most people, when they come to hospital and you tell them they have ulcer, they say, oh, I don't eat. It is not hunger per se that causes ulcer. But if you have ulcer, hunger will worsen it. So that's the thing. So there are a set of things that cause ulcer disease. The first one is actually a bacteria called H. pylori, or we call it Helicobacter pylori. That is one of the main causes of ulcer in most people, particularly younger people. How do we contract H. pylori? It is from food that is contaminated by the H. pylori bacteria. The second common cause of ulcer is intake of painkillers. When you take painkillers regularly, especially for most of us who are in this age group, for some reason or the other, you find yourself having knee pain here, back pain here, shoulder pain here and there. Now, the intake of painkillers, particularly the painkillers called NSAIDs, are one of the second common causes of ulcer. We call it drug-induced ulcers. Then we have other causes that are also associated with ulcer, like stress. And this is where the topic in these days, what do we need to know? Stress is one of those things, but we don't have the time to explain how stress generally causes ulcers, but it does cause ulcers. Then, of course, again, these days, we have people who have problems with obesity, and especially maybe the female group who do what we call the gastric bypass surgeries. Some of the types of surgeries they do may predispose them to ulcer diseases, so we have to take note. Now, what are the risk factors? We've mentioned the things that can cause ulcers, but we also have indirect causes. In other words, things that can predispose you to developing ulcers. I've mentioned H. pylori, I've mentioned the use of drugs. Smoking. Smoking is one thing that can predispose people to ulcer as well. Then the use of alcohol. When you take alcohol, alcohol has a way of diminishing the stomach's resistance to the gastric juices, so you can have ulcer from there. Then obesity. Obesity, that is being too fat. In this case, we define that as having body mass index above 30 in most cases. Then pregnancy. For some of us, we probably have seen when our wives are pregnant, a lot of times they talk about heartburn a lot. Now, this heartburn is actually one form of ulcer that we call reflux disease. I'll come to the types later. Now, as per types, what are the different types of peptic ulcer disease? We have what we call gastroesophageal reflux disease. That one simply means that as you eat food and your stomach gets full, some of the gastric juices, when you attempt to digest, come up to your chest. In other words, to the esophagus or to the gullet, and burns the lower part of the gullet. That gives you reflux disease. That's what is called gastroesophageal reflux disease. I'll come to it in details. That's the first type of ulcer. The second type is gastric ulcers. Gastric ulcers are the type of ulcers we have in the stomach itself. Then we have duodenal ulcers. Duodenal ulcers are the ulcers or wounds that occur in the first part of the small intestine that is connected to the stomach. I will take the GERD, that is the gastroesophageal reflux disease, quickly. Now, this one usually comes, forms in the lower part of the esophagus, and that is because, as the name suggests, there is reflux or backflow of gastric juices into the chest part, and so you have commonly people complaining of heartburn, especially after certain meals. Now, there are certain foods that seem to precipitate or encourage formation of these GERDs. One of them is peppermint, chocolates, alcohol, fatty foods, coffee, acidic foods, that is like unripe fruits, then of course citrus fruits, tomatoes, salad dressings. Those ones are the ones that usually are associated with gastroesophageal reflux disease. Then stomach ulcers. This is the wound that occurs in the stomach itself, where food gathers. And the causes of that anything that causes the stomach wall to lose its protective barrier. Again, because of time, we can't really talk in details. Now, for gastric ulcers, it is these ones that are usually associated with use of drugs, like these painkillers I talked about. For example, one of those painkillers I'm sure we probably will commonly know is diclofenac or cataflam, ibuprofen. Those are the type of painkillers that if you take for a very long time can predispose you to gastric ulcers. What are the symptoms? What do you feel when you have gastric ulcers? Usually you have what is called upper abdominal pain. The pain is almost just below the chest, somewhere here. That's where the pain of gastric ulcer comes. And sometimes there is this nauseating feeling every time you feel nauseated. and sometimes you actually vomit. Now, one classical thing about gastric ulcer is that when you vomit, you feel relieved. That's one thing that will know that this is most likely gastric ulcer. Another thing is that when you have gastric ulcer, when you eat food, the pain gets worse immediately. Once you eat, you have pain, the pain just gets worse as soon as you finish eating. So that's one classical sign of gastric ulcers. And gastric ulcers are more common in elderly people. So we have to take note of that. And it is this type of ulcers that may eventually become cancers later if it is not treated on time. We have seen cases of people developing cancer from ulcers, but it is in the elderly people that you see this most often. Then we have duodenal ulcers, the ulcers that come in the first part of the small intestine. Now this one, how do you know you have duodenal ulcers? In this case, unlike gastric ulcers, the pain, if you have abdominal pain, the pain is also in the upper part of your tummy, but when you eat food, if you have duodenal ulcer, the pain goes down immediately, as against the first type. But after like 30 minutes, or 2 to 3 hours after eating food, that is when duodenal ulcers get worse. And this one is relieved by taking things like Gestid, we call them antacids. Now, and then here, duodenal ulcers, sometimes one of the first signs you may see or observe is that you may be passing dark stools. We call it dark tarry stool. That means you have begun to bleed from the intestine, from that wound. Once you see your stools getting dark, if you are not on blood tablets. What are the complications? I said blood in the stool, black tarry stools, coffee ground vomiting. Sometimes if you have such ulcers and you vomit, you see the vomitus looking like coffee brown, or sometimes frank blood. How do we know when people have ulcers? Of course, it is going to be impossible for you to diagnose yourself. So the best thing is, if you have abdominal pain recurrently and you feel that it is ulcer, it is best you actually approach your doctors for diagnosis. Now we diagnose it from your complaints, and then when we examine, sometimes we know where the pain is situated, and then there's a test, gold standard test we call endoscopy. Scan, please, let's note that scan, ultrasound scan, does not make diagnosis of ulcer, please. Because we see a lot of people going for scan to make diagnosis of ulcer. It does not. The main, gold standard for diagnosing ulcer is endoscopy. In this endoscopy, they will put a small camera through your nose or mouth, and you swallow the camera. The camera will now go through your intestine, and you see it on the screen, and we see the wounds. Now, how do we treat ulcers? We have, when I started, I said the first major cause is H. pylori infection. That's a bacterial infection. So when we're treating ulcers, of course, there are tests we do to know if your ulcer is associated with H. pylori infection. And if it is there, unless you eliminate the H. pylori, the ulcer may never go. So antibiotics are one of the things we use for ulcers. And inshallah, you'll be okay. So assalamu alaikum wa rahmatullahi wa barakatuh.